Good morning, everyone. Thank you for joining us today for our July OCHMS user meeting. Please go ahead and enter your name and agency name into chat for attendance. We will cover the following topics in this user meeting: HMS participating agency schedule. We have some clarity updates, universal multi-factoring authorization, new interface rollout, the HMS recertification, Dropbox cleanup, and we have a data element highlight. We're going to review health insurance. We're going to also review release of information and client record sharing decision pathway, and also discuss verbal consent, offer some guidance for troubleshooting, log into HMIS, a brief overview of the Hicken Shelter Pit. We'll go over Goal 11 and also updates regarding the project performance report and a training update, and have a survey to get everyone's input, as well as a holiday announcement. To better organize questions the help desk receives during the meeting, our team recommends that you submit your questions through the Q&A option. So if you don't see the Q&A option, go ahead and click More, and from that menu, you'll see the Q&A icon. We request that you keep your question general and related to the topics discussed in this meeting. Agency-specific questions is best supported through an HMS help desk submission, so our HMS team is able to further investigate and provide support for your requests. We do have a Q&A section towards the end of the meeting where you can feel free to ask questions regarding topics on this user meeting, and then office hour follows after that, which is open to any general HMS functionality questions. This is our HMS participating agency schedule. It gives you an overview of the year, all the different reports that come online depending on that month of the year. So you can, as an agency, review and prepare and support with reporting. So we do have a link where you can review the schedule in more details. But in the upcoming slides, we will give you a 3-month overview of what's coming up. So in July, our HMS team will be working on publishing the emergency shelter PPR, and we are also sending out street outreach draft data, so your agency have the opportunity to review and make corrections before we publish that report. An agency audit has started. So for agencies that are scheduled for July, you should have already received a ticket and scheduled a meeting with us for July. And our HMS user recertification is kicking off this month, July, and will end in August. And in August, we will continue to roll out agency audits, and we will be working on the street outreach PPR publication. And you agencies that have homeless prevention projects, you will be sent your draft data so that you have time to review and make corrections before that data is published. And then in September, we will be publishing the homeless prevention PPR, and we'll be sending out permanent supportive housing and other permanent housing draft data so that agencies, again, can review your data and make corrections before this report are published. And as mentioned, our agency audits start July and roll out into the fall. So the next round of agencies that are scheduled for September will be given notice about their audit. And we have a staff update, and we just wanted to let our HMS community know that we are so excited to have Jocelyn and Liz join our team. So in the upcoming weeks, you'll see them pop up in our help desk ticket support. So please welcome Jocelyn and Liz to our HMS team.
Hi everyone, I'll be sharing a new Clarity update regarding the Universal Multi-Factor Authorization. Clarity Human Services is moving its authentication foundation to Auth0 on July 23rd. And so one thing that we ask agencies to do is to add the recovery email to allow list. So please ask your IT team to allow list the email address, no reply at bitfocus.com. We wanted to highlight some reasons why Clarity is making this change. And so, first off, enhanced security. The MFA will provide robust protection against unauthorized access with industry leading security protocols. It'll also provide an improved user experience, so a faster, more modern login interface and a more reliable password recovery process. Single sign-on support allows for a simplified integration for agencies utilizing enterprise identity providers. The multi-factor authentication is better at protecting sensitive HMIS data, so the MFA will now be a standard requirement. Users will provide a second form of verification, such as a code sent via email or an authenticator app during login. So users will first enter your email address and then you'll be redirected to the Auth0 screen when logging in. And also a quick note that currently you're able to use either your email or username that we provide when your HMIS account is created to log in. But moving forward, the new login will ask that you only use your email for logging in. And the screenshot to the right is the screen you'll be seeing when logging in with this update for the first time, and it'll let you select with which method you want to use. So some supported authentication methods at launch include one-time password via Authenticator app, so Google Authenticator or Microsoft Authenticator for iOS and Android devices are two popular options. And a note that if users cannot use their phones to authenticate, then they can also use a desktop-based authenticator like Proton. Another method is push notification via the Auth0 Guardian app. And another one would be through your phone. So that can be SMS or text message or voice call. And then lastly, email. And for email, this is only available as a secondary factor. So users must enroll in at least one other authentication method first. Users can manage their enrolled factors directly from their Clarity account settings after migration. So the screenshot above is the screen you would be seeing once we get this update. And so you'll click the staff member icon in the upper right corner, then select account settings in Clarity. And then you'll click security settings under advanced options on the right side panel, as you can see in that screenshot. And then users will see options to manage your MFA. And just noting one more time that email can only be used if another authentication method is set up first and the user does not have access to the phone or authenticator app they set as their primary recovery method. Email cannot be the only or primary authentication method. And that's all I had for this MFA update.
Thank you, Hannah, for the update. Our HMS team will also send an email to all agency admins for additional guidance and steps for your IT to help set this up. And we will offer some office hours, which we will include more detail in that email. So please keep an eye out for an email that will be sent out next week with next steps.
Good morning, everyone. Today I'll begin by going over an additional important update. Clarity updates, new interface rollouts. I want to share an important update that Clarity Human Services new interface will go live on September 1st. The new Clarity Human Services interface is designed to be easy to use and pave the way for future enhancements. The new interface includes tools for collecting and managing data for reporting, case management, and coordinated care. And the new interface will be enabled on the Clarity training site on July 6th. And as you can see, our team has included a brief GIF that showcases what the home landing page looks like for new users who have not yet had a chance to experience the new interface. Next slide, please. HMIS recertification. The 2026 HMIS recertification cycle will begin on July 6th. All users whose HMS accounts were created before January 1st of 2026 must complete the 2026 HMS recertification course. In addition, users with data entry access must also complete the 2026 HMS Part 2 recertification skills test. I do want to pause and note that our team will be sending out a updated newsletter on July 6th that includes all the recertification materials, such as the recertification course and the recertification skills test. Agency administrators must submit the 2026 HMS recertification form for their users by August 31st to avoid having their HMS accounts disabled. To identify which users must complete the recertification, agency administrators should run the agency active users report as needed, and this report can be located by navigating to reports, then data analysis, then Orange County Clarity System reports, and then agency active users. Next slide, please. In preparation for the launch of the Clarity Human Services interface, the HMIS Help Desk will update the Clarity training site for users to complete the 2026 HMIS recertification skills test utilizing the new interface. Users will be able to practice creating client profiles, adding releases of information, enrolling and exiting clients from projects, and modifying household composition through our updated workflows. The HMIS Help Desk encourages users to reach out to their agency administrators for additional help navigating the new interface. And now I will provide a brief demonstration of the new Clarity interface. Elizabeth, can you confirm that you can see my screen right now? I should be on the new Clarity interface.
Yes, we can see the new interface. Thank you, Hugo.
Okay, great. So for all of our users who have not yet had a chance to trial the new Clarity interface, I do want to show you what our home landing screen looks like. The eagle-eyed among you might be aware that this new homepage very closely resembles our previous homepage, which is the client search page. If I navigate over to our old interface here, you can see that one of the primary methods users primarily interact with the Clarity site is through the navigation menu, such as search, caseload, and referrals. In the old interface, these very accessible screens that users recently will frequently utilize are located at the top on the top hand banner. However, in the new interface, I do want to note that these have been moved on to the left-hand side of the screen. You can see here we have our client screen, our referral screen, our report screen, and our attendance screen. You can also see here we have this double caret icon. And if you were to click on this double caret icon, this will expand the section out so it'll include both the icon and the name of the screen. This section can be either be expanded or collapsed depending on individual user preference. I do want to also note that since this is the client search screen, the search screen functionality remains the same. So users can search for clients based on their first name, last name, social security number, date of birth, or any combination thereof, using this search bar right here at the top hand side of the screen. And I do want to also note that below the search bar, we have this recently accessed clients list. This access clients list contains client information of clients that you have either recently searched for or have recently created within HMIS. In addition, I also wanted to identify a few new widgets that will appear on the client search screen. Primarily, these will be considered your caseload widgets. So here we have our active enrollments widget. This widget indicates the number of clients a user has either assigned to them or clients that a user has created in which they are the active case manager. Below that, we have our status due widget, which indicates the number of clients who have a pending annual assessment that needs to be completed. And below that, we have our case manager widget, which will indicate the number of referrals a user has assigned to which they are that client's primary case manager. I do also want to point out that if you were to navigate to the top hand side of the screen, you can see this little moon icon. And if you click on that icon, you can shift over from light mode to dark mode. So this is a new mode that our vendor BitFocus has provided as part of this new interface. Once more, depending on user preference, whatever you feel works better for the workflow, you can either navigate the new interface using this new dark mode or using the previously available light mode. In addition, I do also want to pause and note that while our vendor BitFocus will be transitioning users over to the new interface on September 1st, I do want everyone to note that this is a work in progress and that this transition will also be completed over a series of phases. So while many screens have already been updated into this new interface look, not all screens have yet been updated. For example, if we go over to reports, we can see that will automatically load the report screen in the old interface style. So I do want users to note that this is not a bug. It's just that that specific screen, in addition to some others, has not yet been implemented with this new interface layout. I do believe that is all for this new interface demonstration. So I will go ahead and stop sharing and pass it over back to you, Elizabeth.
Thank you, Hugo. Appreciate you sharing the update. Can everyone see the screen again in full screen? Rachel, if you can confirm.
Yes, I can. Thank you.
Thank you.
Good morning, everyone. The OCHMIS team would like to remind you to please review your agency's Dropbox folder and download any files that you may need by Friday, July 10th. All files will be removed from folders on Wednesday, the 15th. We appreciate your cooperation. Next slide, please. This month's data element highlight is health insurance. The data element is collected for all clients, all project types, and all collection points except follow-up. Health insurance is collected to determine whether clients are accessing all mainstream health insurance for which they may be eligible, along with changes between project start and exit. Please also note that the health insurance field is intended to identify actual health insurance sources. Charity care or other medical-related funding received by a medical provider or hospital to cover healthcare costs does not constitute health insurance coverage and should not be recorded in HMIS. For additional details, please refer to our knowledge base article and guidance from HUD included in our links document in the chat. Next slide, please. Here we have a list of health insurance options. We'll review a couple definitions since some options are very similarly named. Medicare is mostly for those who are 65 and older, but younger people may also qualify based on disability or medical conditions. Medicaid is a combination of state and federal funds. This is also known as Medi-Cal and should not be listed as state health insurance. Next slide, please. HOPLA recipients are asked to provide an explanation for why a no response was selected to any of those insurance options. And another note, typically clients who receive SSI or GR, which is general relief, also receive Medicaid or Medi-Cal. Next slide, please. Wait, just a moment here. I'm going to set up. Confirm that you see the new interface UC training site.
Rachel, let me stop sharing and go ahead and share. I can see the new interface now. Yes.
Oh, okay, awesome. Thank you. All right. And so for this demo, we're going to be reviewing health insurance types and response options. And as with all of our demos, we're going to be using the OC training site, the fictitious client information. I'm going to go ahead and search for my client. Find my client here. And then for the purpose of this demonstration, I'm going to be entering in this information regarding health insurance at exit. And so I'm going to go to the Programs tab on the left. I'm going to expand here. And then I'm going to go to the bar right here to exit. Okay. I'm going to go down here. What happened? So I'm going to go and I'm going to change this. Sorry about that. Okay, here we are. And so let's go ahead and select yes for this. And here we can see the options. We have Medicaid, Medicare, State Children's Health Insurance Program, Veterans Administration VA Medical Services, employer provided health insurance obtained through COBRA, private pay health insurance, state health insurance for adults, Indian health services, and other health services. And for this demo, we'll say that the client set Medicaid. We'll go ahead and click save. And that information has been updated and we can see that here. And that is it for me. Thank you.
Thank you, Rachel, for the overview and demo. Hugo, can you verify that you see the training slides again full screen?
Yes, I can see the training slides in full screen.
Thank you.
Hello, everyone. I wanted to come back to go over release of information and our decisions pathways. As part of the client intake process, users are required to ask clients if they consent to share their information in OC HMIS. In the client privacy screen, users are able to document whether or not a client has provided consent to share. Client consent is not needed to ask for the information or to enter it into HMIS. Client consent is only needed to share that data within OC HMIS. Clients who provide consent should have their client profile set to public, while clients who do not provide consent should have their client profile set to private. I do want to also note that unaccompanied minor clients cannot provide consent to share their information and must have private client profiles created for them. If a client does provide consent to share their information, users must document how that consent was obtained via a release of information, otherwise known as an ROI. And the following forms of documentation are available to users in OC HMIS. Those being electronic signature, in which a client digitally signs a form in Clarity HMIS indicating their consent to share information, through attached PDF, which is an uploaded document that contains a client wet signature, which indicates their consent to share information, verbal consent, which is a temporary form of consent that should be updated later on to either electronic signature or attached PDF, and household, which is specifically for minor clients whose head of household provided consent for them. For more information about this topic, please reference our Accessing and Completing Release of Information KB article and our Client Record Sharing Decisions Pathways document. Next slide, please. For the more visual learners among us, our team has also created this HMIS Client Record Sharing Decision Pathways document for users to quickly and more easily identify how exactly releases of information and privacy sharing should be entered within HMIS. So if we look at this document and begin on the left-hand side where it says Start, specifically that is those boxes highlighted in gray, we can start by searching for an existing client profile in HMIS. And we can ask ourselves the question, does this client have an existing HMIS record? For this example, we will go ahead and assume that no, the client does not have an existing HMIS record. So we can shift over to the boxes indicated in salmon. There we can see that no, so we will go ahead and create a new client profile for that client, and we will go ahead and enter that client data as provided by that client. After we have entered that client data, we will ask ourselves an additional question. Does this client consent to share their records in HMIS? If the answer is no, we will shift over to the boxes highlighted in yellow and enter their release of information as no and save the client record. Then we will go ahead and set the privacy option to private, and that will be the end of this specific record sharing pathway. However, if the answer to our previous question, does this client consent to share their records in HMIS is yes, then we will go ahead and enter their release of information as yes and save their client record as a public facing profile.
Clients with verbal consent ROI records. Verbal consent may be used temporarily when a signed consent to share protected personal information form cannot be obtained at enrollment or service delivery. It is not a permanent replacement for a signed consent form. When verbal consent is selected as the ROI documentation type, agencies must obtain the client's signed consent as soon as possible and update the ROI record in HMIS. Regularly review the clients with verbal consent ROI records report to identify clients who still need signed consent. Verbal consent should only be used when no other method of obtaining consent is available. For more tips, please see our verbal consent guidance HMIS knowledge base article. Clients with verbal consent ROI records. To see which clients must be contacted to complete a consent to share protected personal information form electronically in HMIS or on the paper form, you would start by clicking the menu button, going to the report section, selecting data analysis, and then clicking on Orange County Clarity System reports, running the report next to the client's and verbal consent ROI records, selecting your filter, entering your agency's name, and then selecting run. You can click the number that appears in the client's personal ID column to see a link to the client's profile in Clarity. Share my screen here. Elizabeth, can you please confirm that you can see the new interface?
Yes, I can see the new interface. Thank you, Michaela.
Thank you. Okay, so good morning, everyone. Today I will review the proper use of the verbal consent in HMIS, when it should be used, and the steps agencies must take to obtain a signed ROI after verbal consent has been documented. This training is important because verbal consent is intended as a temporary solution and does not replace a signed consent to share protected personal information form. Examples where a client is unable to provide a signature at the time of services and them being provided would be a phone intake, a technology barrier, an emergency or crisis situation, or temporarily unable to complete paperwork. In these situations, HMIS allows users to document a verbal consent as a RI documentation type. However, verbal consent should be used when obtaining a signature if it's not possible. Again, verbal consent is temporary, and a signed consent to share protected personal information form must be obtained as soon as possible and documented in HMIS. For the first part of our demo, we're going to record a verbal consent, starting with our fictitious client here. Over to the right, over to the left, we'll go ahead and go to the privacy section. As you can see, the client does not have a release of information or ROI on record, so we'll go ahead and add that here. So for permission, we'll select yes. We do have our start date as of today and our end date 7 years from today. And our documentation type, we'll go ahead and select verbal consent. and then we'll save that document. Notice that selecting verbal consent allows us to document the client's permission to share information when a signature cannot be obtained immediately. Again, this is not considered complete documentation, and it does require a follow-up. So a common misconception is that once a verbal consent is entered, no additional action is required. This is incorrect. Verbal consent must be followed by obtaining a signed consent to share protected personal information form whenever possible. Agencies are responsible for tracking and completing these outstanding consent records. For the second part of our demo, we'll be finding clients who need signed consent. So let's look at how to identify clients who still require a follow-up. For this example, I'll go ahead and start. With going to our reports. So over to the left, we'll go ahead and select reports. As you can see, the interface has switched back to the original version. As Hugo stated, this is because not all screens have been transitioned into the new interface quite yet. Once you have arrived to the report library, you're going to go ahead and select data analysis. Selecting Orange County Training System reports. And now for our live site, it would be considered clients with verbal consent ROI records. Before our training site, the report is called Training Site Verbal Consent Test Agency Filter. So we'll go ahead and run that here. I've already pre-populated this report just because it does take a while to run. So this is what the report will look like. When adding your agency name, you'll add your agency name here. And then to run it, once it populates, you'll see a report below showing that these are the clients that still have verbal consent and that it needs to be updated. So as stated before, you are able to select the client's profile under the client ID. And then just for the purposes of showing the new interface, let's go ahead and switch back. When needing to update the ROI record, again, you will go ahead and select the privacy section. The client already has an ROI on record, so we'll just go ahead and update that. And for documentation type, we'll do attached PDF. For training purposes, I've already pre-populated a consent form, so we'll go ahead and save that. And the client's information has been updated. You will now see that the documentation types has attached PDF. So again, with reviewing this report, you can review the client's information, click the client ID, navigate directly to the client's profile, and update documentation once a signed consent has been obtained. This report should be reviewed regularly as a part of your agency's data quality process. And best practices, use verbal consent only when a signature cannot be obtained. Obtain a signed consent form as soon as possible. Regularly run the clients with verbal consent ROI records, report often. And then just making sure that your client is staying up to date with case management and routine data quality reviews. Thank you guys so much for your time, and this is the end of my demo.
Thank you, Michaela. Michaela, can you verify that you see the slides again full screen?
Yes.
Okay, thank you.
Troubleshooting HMIS login. Our team would like to share a few helpful tips for troubleshooting login issues with Clarity. A good first step is to verify that you're accessing the correct website. While the differences between the Clarity Live and Clarity training sites are subtle, there are a few key visual indicators that can help you identify each one. On the left is the Clarity Live site. Notice that the side panel is gray and includes login tips. Another way to verify you are on the correct site is by checking the URL, which begins with OC Clarity HS. On the right is the Clarity training site. Here, the side panel is dark blue and the text indicate that this is the training environment. The URL for the training site begins with oc.train. Taking a moment to verify these visual cues and the URL can help ensure that you're logging into the correct Clarity environment. Continuing, users may also find following steps helpful. For agencies that use Clarity across multiple continuums of care or COC, the sites may appear nearly identical. Because of this, it is important to verify that the URL contains OC to ensure that you're accessing the correct environment. Additionally, please keep in mind that the password reset links are only valid for 60 minutes. If your link expires, you will need to request a new password reset email. For agencies that use Clarity in multiple COCs, such as LA County, these sites do look very similar. So please, again, check the URL. Check spam folders. If you can't find your reset email, you may need to check with IT about any spam filters. And then agency admins can run agency active user reports to see if a user account was disabled due to an inactivity. Please remember that the system automatically disables users' accounts after a 60-day period of inactivity. For more tips, please see our troubleshooting logging into HMIS knowledge base article.
Thank you, Michaela. This is a brief overview of our 2026 housing inventory count. As you can see on the chart, we are reviewing the housing inventory count over a period of time. And you can see under the chart, each color line correspond to that project type. So we wanted to share that we are seeing a decline in other permanent housing, a decrease of 601 beds. Part of this is due to emergency housing voucher, which was issued during COVID, and those vouchers are now going to be sunsetted this year. So we will continue to see a decline in other permanent housing due to emergency housing vouchers. We will also see a decline in permanent housing, permanent supportive housing due to changes to funding with HUD. So another project type that we'll see a decline in. We also saw a decline in emergency shelter year-round and seasonal beds, a decrease of 377 beds. But we wanted to highlight something that we did see an increase in rapid rehousing, which in the past we did not. An increase of 142 beds, and this can be accounted due to new funding source such as through AB 977, which funds some of our newer rapid rehousing programs. There are links to our HIC overview as well as our shelter pit overview, and the Office of Care Coordination in partnership with CityNet also prepared the 2026 pit summary. All those links are available, so please feel free to further review those reports.
So today I will be going over goal 11 on the project performance report. And goal 11 is to ensure that permanent housing in COC and ESG funded projects should be receiving referrals from coordinated entry. And this is to ensure that the highest priority clients are receiving housing resources that they need to end their homelessness. And the applicable goals, project types for this goal is rapid rehousing and permanent supportive housing, both at a goal of 100%. The universe for this goal includes head of households with the project start date during the reporting period. So this measure compares the number of new enrollments in the housing project during the reporting period to the number of completed referrals to the housing project during that reporting period. Completed referrals means that a household was matched to the housing opportunity through coordinated entry system, and that match resulted in enrollment in a housing project at that agency. Clients entering from the following locations are excluded from this measure: rental by client with rapid rehousing or equivalent subsidy, or permanent housing other than rapid rehousing for formerly homeless persons. Clients from the following rental subsidy types should also be excluded from this measure. And those rental subsidy types are permanent supportive housing, rapid rehousing or equivalent subsidy, and other permanent housing dedicated for formerly homeless persons. So I will be demonstrating goal 11. This will walk you through on how to run the report, identify the affected clients, and correct the error. Elizabeth, can you please confirm that you are able to see the new interface?
Yes, we can see it. Thank you.
Okay, perfect. So for this demo, I'm going to be logging into the HMIS using the training site. And again, this is all the client information that you will see on the site is fictional and is used for training purposes only. The same report is also available on the live site where you can run it using real client data. So once I am logged into HMIS, I will navigate to the report tab on the left-hand side of the screen. And then from there, I will select data analysis, open up the OC training system reports, and then run the PSH other permanent supportive housing and other permanent housing project performance report located under the performance report section. And to save some time, I've already ran the report and I have it open on the next screen. So on the Goal 11 tile, you will notice that enrollments that have been successfully linked to a CS referral are displayed in blue. But for today's demonstration, we are going to focus on the enrollments without a CS referral, which is shown here in this pink fuchsia color. And these are the records that you will want to review to determine whether they need to be corrected. So one of the great features for this dashboard is that it is interactive, so you can drill down directly from the charts. For example, if you click on the pink section, it will take you to the list of clients who have an enrollment but do not have a CS referral. Ooh, why is this not working? And this will make it easy to identify which client records need to be reviewed and corrected. So here we have a client on the report to review. On the enrollment screen here, you will normally see a link icon indicating that the enrollment is linked to a CS referral on the right-hand side of the enrollment. But however, in this example, there is no link icon, which means that the enrollment is not linked to a CS referral. I also have another client here where you can see the link icon next to the program enrollment. This indicates that the enrollment has been linked to a CS referral. And if you hover over the link icon, you can confirm that is linked to the correct enrollment. So going back to my previous client, if you go to the history tab here and open up the referral, you can see that the client was added to the community queue. You can see that the client was added to the community queue and originally referred to the rapid rehousing program. However, after reviewing the client's needs, the agency determined that the permanent supportive housing was a better fit. So the client was ultimately matched to the permanent supportive housing instead, which is why the referral here is still showing up as pending because it has not been linked to the appropriate program. So in order to resolve this issue, the client must be enrolled to the appropriate project. In this case, it would be the permanent supportive housing rather than the rapid rehousing project. And once that client has been enrolled into the correct program, you can submit a ticket to the help desk. And then from there, our team will review the referral, make the necessary corrections, and create the proper linkage to the CS referral and link the client enrollments to the appropriate program. And that is all I have for Goal 11. Thank you so much.
Thank you, Linda. And wanted to add a note to Linda's demo. Once you submit the ticket to request our HMS Help Desk support with creating that linkage, it will close out that link CS referral. So the pending status would be resolve and have an end date to the referral, and that link icon will then populate next to that program enrollment. Amy, can you verify that you see the full screen?
Yes, I can see the full screen.
Thank you.
Project Performance Report PPR. The emergency shelter PPRs will be published on our website in the upcoming weeks. Current and past PPRs can be found on the Orange County HMIS website by navigating to Reports, Project Performance Reports. Corrections for the street outreach PPR draft data will be uploaded into Dropbox this week. The project performance overview is a helpful document that provides important information regarding the PPRs, including the thresholds for each goal and our publishing schedule. Training and resources. The OCHMIS team will be hosting a new Clarity Interface training webinar that is going to occur on Wednesday, July 8th at 2 p.m. The link will be embedded on the slide, but we'll also be sending out an announcement that contains the meeting information as well. On the slide, you can see the meeting ID as well as a link to join the meeting. Registration is not required. Please review the OC HMIS calendar on our website to find upcoming HMIS meeting and training details. The HMIS team also invites users to complete our HMIS user meeting survey. The feedback from the survey is used to provide feedback on select topics at our monthly user meetings. We'd greatly appreciate any topics ideas that you might be interested in and reviewing in upcoming meetings, or if you have feedback that you would like to provide, we also welcome that as well. I've just added this month's survey link in the chat if you'd like to provide that feedback now. Thank you all. And the HMIS team will be out of office for the upcoming holiday will be out of office on Friday, July 3rd in observance of July 4th, and we'll be back in the office on Monday, July 6th to assist you.
Thank you, Amy and team. So that is all the topics we have for today's meeting. A friendly reminder, in case you joined us a little bit later in the meeting, please enter your name and agency name into the chat for attendance. A friendly reminder that all of our meeting materials, slides, meeting minutes, and recording will be available on our OCHMS website, and we will send a recap newsletter where you can access that or go directly to the website. So we do have some time for Q&A. So if anyone has any questions for any of the topic that was covered today, feel free, you can enter your question into the Q&A section or feel free to unmute yourself. I don't believe I see any questions in the Q&A, so I just want to thank you, everyone. Oh, sorry, before we move forward, we do have a question. When will the new interface be rolled out? So the new interface will be rolled out September 1st, but we will be giving all users access on our training site for the HMS research so that you will have the opportunity to test it out and practice on the training site before it goes live into the Live Clarity site September 1st. As Amy mentioned, we do have our training next week, so we encourage all users to attend if they're available to review the new interface and workflow. Our team will be going through the research screen, client profile, enrollment, and all the different workflows so that you can get an overview of the new interface. Well, thank you for your question. But I don't believe I see any other questions coming in. So I just want to thank you everyone for joining us today. Our next user meeting is August 5th. And please feel free to share your feedback in our survey so that we can get your feedback on this meeting and any future meeting topics. So thank you everyone for joining us and have a great day. We'll go ahead and shift over to office hours